Okay guys, let's move on to the next topic, which is nursing as a profession. It says here that a profession is an occupation that requires extensive education or calling that requires special knowledge, skills, and preparation. So in your case, you are studying Bachelor of Science in Nursing, you are building up your knowledge, building up your skills in preparation to be a professional nurse. To be recognized as a profession, it has to meet several criteria. Nursing has gained its recognition as a profession because it meets the following criteria. One is specialized education. In nursing, it is recommended that a baccalaureate degree is required as the entry level for professional practice. It includes biology, social sciences, nursing disciplines, research, and other disciplines that makes up the baccalaureate program. So it is such kind of specialized education, eh? Next is body of knowledge. As a profession, nursing establishes a well-defined body of knowledge and expertise. That is the reason why nursing has several conceptual frameworks which contribute to the knowledge base of nursing and give direction to nursing practice and education as well as ongoing research. Next criteria is service orientation. Nursing has a tradition of service to others, but this service is guided by certain rules, policies, or code of ethics. For this, nursing is considered a very important component of the healthcare delivery system. Next criteria is ongoing research. Nursing research is actively generating, publishing, and applying research in practice to improve client care and enhance nursing scientific base. For example, Standards of Clinical Nursing Practice, which is published by the American Nurses Association. It includes research as one of the standards of professional performance. Because of ongoing research, we now have the evidence-based practice wherein nurses uses research findings in their everyday practice. Next criteria is the Code of Ethics. The Code of Ethics is a formal statement of the group's ideals and values. Nursing has developed its own Code of Ethics and in most instances has set up means to monitor the professional behavior of its members. The Code of Ethics influenced the moral decision-making process of nurses. Next criteria is autonomy. To practitioners of nursing, autonomy means independence at work, responsibility, and accountability for one's actions. So once you have your license, you are already accountable to your own act. A profession is autonomous if it regulates itself and sets standards for its members. Our nursing profession is autonomous because it functions autonomously in the formation of policies and standards, and it is in control of its actions. And the last criteria is professional organization. Nurses need to work within their professional organization. Example, American Nurses Association is a professional organization that advances the nursing profession by following. One is fostering high standard of nursing practice. Next is promoting the economic and as well as general welfare of nurses in the workplace. They do lobby the Congress and other regulatory agencies on healthcare issues affecting nurses and the public. Now, in the Philippines, it is the PNA who is doing this. So you learned about the criteria of a profession. Let's discuss about the personal and professional qualities of a nurse. Nursing is a noble profession. The qualities of a nurse is what makes them special and fitted for the job. Check on yourselves if you have these qualities. If not, you can start building it up from now on. So let's see what are those qualities of a good nurse. One is good communication skills. Communication is a therapeutic tool that we use to build interpersonal relationship with our patient. Nurses have lists of different therapeutic communication strategies to use to communicate with patients. Good interpersonal relationship with our patients allows us to carry out our clinical jobs more easily while keeping patients engaged in their care. So, do you have good communication skills? Well, start building it now. Another quality of a nurse is a caring nature. Caring is the core of nursing practice. A nurse with a caring nature makes their patient wanted, supported, and making them feel that they are in safe hands. Next is empathetic. You are empathetic if you have the ability to understand how patients are feeling, especially hospitalized patients who have traumatic or emotional experience that needs a nurse who understands their feelings and give them the emotional support they need. Next criteria is adaptable. As a nurse, you must be prepared for any eventualities on a day-to-day basis in a workplace situation because things can happen at any time and at any minute. You must also be adaptable to change because, as everyone knows, change is constant. By learning how to be more adaptable, you will be able to be well equipped to respond when faced with a difficult situation or a crisis. Next criteria is emotional stability. Nurse's job is mentally demanding, but we are just human and infallible. We are prone to emotions, emancipated by stress, which sometimes affects our work. However, as a nurse, we have a responsibility to our patient to offer stability while at work. What if the stress comes from our bullying seniors? What must we do? It is documented that ventilate yourself in a positive manner to encourage emotional stability, because communicating with people around you might only make things worse. So just go in a private place, talk to yourself, burst your anger or sentiments. You can cry if you want, but still you have to re-establish your emotion. Be positive. But what if the stress came from your own patient? What must you do? As a nurse, we have a wide range of understanding people. So try to find out what makes your patient act that way. Or other way, talk to other nurses around you. They might have the same experience at what you do and can help you solve the problem. Next quality of a nurse is physical and mental endurance. Being a nurse means some days will sometimes have little or no breaks at all. Yet, our job requires the ability to bend, turn, twist, lift, or stand regularly. So, to get through the day, we must have outstanding physical and mental endurance. So, what are we going to do? Exercise will enhance our endurance. We also have to invest in comfortable shoes. Then, take a short break. Tiredness affects the body and mind and may affect the quality of work that you do. So, take a short break. Now, in nursing, there is not particularly a special break. You can have your break at any time once there is a chance. You can sit down, but while sitting down, you are doing the charting. So it's not completely a break, but resting your feet. As well as don't ignore your hunger. If you do not have chance to eat, take at least a pick of food, okay, just to cover up your hunger. Now, do you have organizational skills? Being organized is a vital quality of a nurse. This includes neatness, ability to prioritize, ability to delegate, and time management skills. Neatness means your station is organized. Your desk where you're working is fixed, like files are filed in the proper cabinet or rack. Neatness also reflects your personality, the way you dress up, the way you wear your shoes, the way you fix your hair. Neatness also reflects on the things that you do. Your caring of your patient, the neatness of his surroundings, the bedside table. If you're a neat nurse, things around your patient will also be neat and organized. Next is the ability to prioritize. One of the skills and the organizational skills is ability to prioritize. Nurses need to prioritize things at the start of the shift and to reprioritize them throughout the day as the situation changes. For example, you made a list of priority tasks that you're supposed to complete, but in the middle of the day, you receive a new patient with doctor's order, and some of the orders need to be accomplished immediately. So you need to reprioritize again your things for the day. Next is the ability to delegate. To delegate is being responsible for how someone else performs a job on your behalf. So you have to know what to delegate and with whom should you delegate. Next in the organizational skills is the time management skills. Working as a nurse in a hospital is always time sensitive. Every procedure needs time preparation. See, you have lots of things to do in a hospital, like for example, preparing and administering medications, vital signs taking, feeding patients, doctor's rounds, carrying out doctor's orders, hygiene of patient that you have to take care of, wound dressing, and many others. But nurses make it work by being organized. You see, you have to plan, organize, prioritize, and delegate, and you can make most of every minute of the day. Next is ethics. Ethics serves as moral compass for nurses, wherein nurses constantly make decisions that are in the patient's best interest, especially when the right things to do is not obvious. For example, a patient wanted you to tell him about his condition even if it's something uncomfortable for him to listen or to hear. Such situation occurs every day in the nurse's life in a hospital setting that requires ethical behavior. So what must you answer? Well, the safest way to answer is the doctor will discuss with you about your condition. Next quality of a nurse is detail-oriented. Paying attention to details is very important for nurses. Even a simple comment or response from a patient may hold the key to helping them. So, as a nurse, listen very well, be observant, and document everything in details. Next is critical thinking skills. In a work situation, it would mean life and death to some patients. So, as a nurse, you must think quickly and get decisions right. Critical thinking is a scientific way of making quick decisions with good judgment. If you have this skill, you have the ability to evaluate facts and come to a rational conclusion, to troubleshoot difficulties in clinical settings quickly and accurately. Next quality is open-mindedness. Every situation in your workplace is different. Patients come and go. Some patients may have different traumatic or emotional experiences with different cultures and beliefs. This may affect their way of thinking and behavior. Only by being open-minded can a nurse provide effective, culturally competent, and patient-centered care. Next is respectfulness. Respect is the boundary that defines a therapeutic relationship and makes it possible to take care of every patient. So we have to respect our patients no matter who they are. But respect will not only be for the patients. We also have to respect our colleagues and other members of the healthcare team. Next is assertiveness. Assertive individuals understand that conflicts can be both respectful and constructive. Assertive individuals have the ability to express their thoughts and feelings with respect despite of possible unfavorable outcomes. An example here is reporting an error or unethical behavior on the part of a colleague that can create stress in the work environment. But as a professional, it is your duty as a nurse. So you have to report it. Another example is a nurse who suspects that a child is being abused, which is a mandatory reporting, okay? But bringing the situation to the attention of the proper authority will surely cause conflict between the nurse and the parents of the child. But as a professional, it is your duty. Next quality is reliability. Means consistently doing what is expected and doing it well. Easier said than done, huh? An example here is that an outgoing nurse is expected to be off in an hour, but 30 minutes prior to the due time, the incoming nurse phoned in to inform that she cannot make it due to emergency. And there is no other nurse to work for the nurse shift, so the outgoing nurse had to extend her duty for another 8 hours. Some nurses may feel upset about this, some may feel that it's unfair, some will be grumpy, but a reliable nurse will still do what is expected of her and doing it well. Sometimes you may feel that life balance is not possible, but it's possible with different strategies. Like for example, if you work double shift today, the following day you'll be off duty as per your supervisor's order. Next is compassion. Compassion begins with empathy, but it's more than just understanding of someone's feelings or sufferings. It is the willingness to do something about it. For example, you notice that a female patient was upset about something, but she cannot make it. Like when you ask him, you find out that she wanted to fix her hair, keep her bedside clean and neat because it's almost visiting time. So here, it is taking your time to do it for her because she can't afford to do it. Compassion, as the cornerstone of nursing, makes all the difference in the lives of people in need. The last one is a team player. As a team player, a nurse works smoothly with patients, families, and the interdisciplinary healthcare team at every day in every step of the way. As a team player, you are also able to build trust with colleagues and thus continues developing team effectiveness. We will have in-depth discussion about team player and the further chapter of our topics. Okay, so let's see what are different nursing fields we have. Nursing fields are constantly evolving. The demand for nurses are continuously growing even at this COVID period. The nursing career path also offers many worthwhile benefits. Most of the fields listed here have expected job growth for up to 15 to 20% by year 2022. So let's take a look at the different fast-growing nursing fields. In the list, we have dialysis nurse, legal nurse consultant, nurse midwife, nurse anesthetist, nurse case manager, nurse educator, nurse practitioner, nurse researcher, informatics nurse, travel nurse, chief nursing officer, nursing administrator, clinical nurse, and diabetic nurse. Family nurse practitioner, health policy nurse, medical surgical nurse, my forte, nurse advocate, nurse attorney, pain management nurse, peri-anesthesia nurse. The list is so long. Psychiatric nurse, trauma nurse, orthopedic nurse, neonatal nurse, pediatric nurse, geriatric, and public health nurse. Then we have oncology nurse, clinical nurse, EON nurse, infection control nurse, QI nurse, and patient safety officer. So these are the nursing fields by specialties. If we look at the nursing fields by occupation, we have institutional nurse, public health nurse, private duty nurse, occupational industrial nurse, nursing education, military nursing, school nursing, independent nursing practice, and clinic nurse. So this is the end of our topic. I'll see you again next week.